Hello and welcome to our third webinar on meeting complex needs for our clients. In this session we'll look at participating in planning for leisure and health programs for clients that have complex needs. We'll focus on participating in the profiling for specific client needs, contributing to the plan for addressing the impact of client issues, characteristics and their symptoms, and participating in the development of effective strategies for working with clients who have complex needs. The first step in participating in the planning of a leisure and health program for clients with complex needs is to determine your client's specific issues, characteristics and symptoms. Let's look at these terms now. A health issue is simply a health problem a person may experience, and specifically one which may impact on a person's participation in a leisure and health program. According to the Australian Institute of Health and Welfare in 2014, the most common health issues in Australia include cardiovascular disease, such as coronary artery disease and heart disease, and stroke, cancers, such as lung cancer and colorectal cancer, mental health disorders, such as depression, diabetes, respiratory diseases, including asthma and chronic obstructive diseases, musculoskeletal diseases such as arthritis and osteoporosis, and chronic kidney disease. Depending on the nature of the group of the clients you're working with, you may identify a variety of health issues within the group. For example, you may have clients that have poor mental health. You may have clients who are overweight and obese, and you may have clients who have respiratory issues. You will need to consider these things when you're planning the program. It's important to note that some health issues are underpinned by factors which cannot be changed. For example, it's impossible to change a person's genetic predisposition to diseases. However, there are also health issues underpinned by factors that can be changed to reduce a person's risk of illness. If these modifiable health issues and modifiable risk factors are addressed, it can improve a client's participation within the leisure and health program. Clients' characteristics refer to the features which make your client unique. This may include age, gender, culture, and physical fitness, etc. Considering a client's characteristics in developing a leisure and health program is essential to ensure this program is customised, that it is going to meet the unique needs and goals of your clients. This will help to ensure the program is relevant to the client and therefore more likely to be effective in enabling them to meet their needs and their goals. A client's symptoms describe the physical, psychological and the other effects of their conditions with which they've been diagnosed. A client's symptoms can impact on their ability to participate within the activity program. In planning leisure and health programs, it's important that you're aware of a range of complex needs which may affect your clients. A client may have a variety of complex needs. This may include physical needs. For example, they may be unable to walk. Emotional needs. They may become distressed or upset at times. Their cognitive needs, such as a client having a diagnosis of Alzheimer's disease. This could impact on their ability to do certain activities. Sensory needs, such as hearing loss, or a client refusing to wear their hearing aids who has hearing loss. Communication needs. This could include a client who slurs their words when speaking due to them having a past history of a stroke. Psychiatric needs. This could include a client who has a diagnosis of depression and self-isolates themselves, refusing to participate in activities. There are also needs associated with disadvantaged groups, and we'll discuss this later on in the webinar. It's important to note that people, including our clients, their significant others and other staff, may have a variety of different expectations for the client's participation within the leisure and health program. These may include things such as improved fitness, balance and coordination, improved movement, improved capacity, social interaction, improved fitness when it comes to cardiovascular fitness, improved self-esteem, to engage in relaxation techniques, the release of endorphins to make the client feel better, to learn certain or specific skills, and to see certain or specific health outcomes. It's important that you respect the different expectations of their clients, their significant others and staff for the client's participation in the leisure and health programs. When planning leisure and health activities for clients with complex needs, it's important that you take a strength-based approach. Strength-based approach will allow you to focus on the client's strengths rather than their various challenges, barriers and disabilities. Let's have a look at this now in more detail. When you're using a strengths-based approach, you should view situations realistically and look for opportunities to complement and support the existing strengths and capacities of a client rather than focusing on their problems or concerns. A strength-based approach moves away from a deficit-based approach, and it consists of questioning strategies to identify what works for the client and how it works, so those strategies continue to develop a person's abilities rather than enhance their disabilities. As a leisure and health worker, it's important that you're familiar with the facilitation methods for a variety of leisure and health activities. There is a variety of leadership and facilitation techniques you can use when delivering leisure and health programs. Consider the following points when facilitating programs. Plan activities for participants which are consistent with their needs, physical abilities or limitations, preferences, interests, beliefs, pace and timing requirements. Use strategies to facilitate participation. Help to guide and control the group process, for example, by setting ground rules, getting the group process flowing, keeping the group's momentum and energy, and summarising and monitoring throughout the program. You also need to create records. In addition to client care plans, there'll be other documentation, such as activity tick sheets that you'll need to complete at the conclusion of an activity. It's important that you're familiar with the quality improvement accreditation systems relevant to leisure and health workers and the implementation of leisure and health programs. Many organisations will have internal improvement processes. These usually involve evaluating leisure and health programs to draw conclusions about their effectiveness. We're now going to look further at accreditation and how it impacts on residential aged care facilities. Do you understand what accreditation is? So, accreditation under the aged care services, they must meet their accreditation requirements as per the Aged Care Act 1997 for aged care facilities to be eligible to receive Australian government care subsidies for their care recipients or their residents. For those of you that are currently working in residential aged care facilities, have you ever been involved in an accreditation visit? For some staff, if it's the first time they've been involved in an accreditation visit, they can become nervous. The best thing that you can do is to do your job as you normally would and answer any of the questions that the auditors ask you to the best of your ability. The accreditation process is made up of unannounced visits. These usually occur at least every year and can occur more often if there are any issues at the facility or following events such as a gastroenteritis outbreak. These visits can occur on any given day, most likely between Monday and Friday, when auditors come and assess the aged care facility against any of the 4 standards and 44 outcomes. Another component of the accreditation process is the scheduled accreditation. This occurs as per a schedule, and it's based on how well an aged care facility did at their previous accreditation. For example, if an aged care facility passed all 44 outcomes at their last scheduled accreditation and received a 3-year accreditation, they would not receive another scheduled accreditation for another 3 years, unless in the meantime there were issues to rise at the aged care facility. Let's now look at the accreditation standard that relates directly to leisure and lifestyle staff that work within residential aged care facilities, and how accreditation and the process can impact on your work role. The standard that relates directly to leisure and health is Standard 3, Care Recipient Lifestyle. The principle of this standard is care recipients retain their personal, civic, legal and consumer rights and are assisted to achieve active control of their own lives within residential care services and the community. The outcomes that make up this standard include 3.1 continuous improvement. That means the organisation has to actively and continuously improve on their practices. Regulatory compliance, 3.2. The organisation's management needs to have systems in place to ensure compliance when it comes to all relevant legislation and regulatory requirements. 3.3. Education and staff development. Management and staff both have to have appropriate knowledge and skills to perform their roles. 3.4. Emotional support. Each care recipient should receive support in adjusting to their new environment and on an ongoing basis within the facility. 3.5. Independence. Care recipients are assisted to achieve maximum independence, maintain their friendships and participate in their life within and outside the aged care facility. 3.6. Privacy and dignity. Each care recipient has a right to privacy and dignity, and also confidentiality should be respected. 3.7. Interests and activities. Care recipients are encouraged and supported to participate in a wide range of different interests and activities that are of particular interest to that individual. 3.8. Cultural and spiritual life. Individual interests, customs, beliefs and cultural background should be valued and fostered within the facility. 3.9. Choice and decision making. Each care recipient should participate in the decisions about the services they receive. 3.10. Care recipient security of tenure and responsibility. Care recipients have a security of tenure within the residential aged care facility, and they need to have an understanding of their rights and responsibilities. So when the auditors come out to do a scheduled accreditation, they will look at all of these 10 outcomes that fall within Standard 3. So aged care facilities will have ongoing processes internally to audit and monitor their systems to make sure they're going to be compliant when the auditors come out. Although the participation in health and leisure activities for people with complex disabilities is recognised to be fundamentally important, people with complex needs may face a variety of barriers to participation in these activities. It's important to understand the impact of these various issues, characteristics and symptoms on a client's ability to participate in the leisure programs. For example, a client may be precluded from a leisure activity involving physical activity because physical activity exacerbates symptoms such as pain or breathlessness. A client may have a cognitive or behavioural problem which makes it unsafe for them to participate in certain activities. A client may have sensory needs which makes participation in activities, for example those with bright lights or loud noises, challenging and unenjoyable for the client. A client's needs or religious beliefs may prevent them from participating in certain activities. For example, activities involving another gender. A client may have communication needs, which makes it difficult for them to communicate the types of leisure and health activities that they enjoy. You can identify the impact of issues, characteristics and symptoms on clients' participation in leisure using a consultation technique that we've previously discussed throughout other webinars. In particular, it's important that you speak with the client, their family or carer, and medical and other staff that are involved within that client's care. Once you've identified the complex needs of your clients, it's important that strategies and modifications are put in place to assist the client to participate within the program. Some examples can include using modified equipment to enable the client to participate in the activity with minimal assistance and also in a safe and effective way. Modifying the location in which the program is supposed to take place. Considering a smaller group size if clients have greater support needs. Making sure there are regular breaks in the program for clients who require this. And responding to the barriers to participation in recreation and leisure activities. Remember, it's important that you consult with the client and other stakeholders to identify appropriate strategies and also modifications. Identifying strategies and modifications that will enable a client to maximise their participation in leisure and health programs involves designing leisure and health programs that promote wellbeing, social justice and equity. It's important to understand there is a continuum between health and illness. This is illustrated on the following diagram on the slide. Moving from the centre to the left shows a progressively worsening state of health. Moving to the right of the centre indicates increasing levels of health and wellbeing. Treatment can bring you to a neutral point where symptoms of the disease may be alleviated. It's important when planning leisure and health programs for clients with complex needs that you focus on promoting wellbeing as well as social justice. Social justice includes the distribution of wealth, opportunities and privileges within a society for all that live in the community or the society. In considering social justice, it's also important that you consider equity of clients with complex needs. Health equity is about everyone within the community having the necessary knowledge, skills and resources to achieve and maintain good health and wellbeing. It's about having the right services provided in the right ways and in the right places to support the health and wellbeing of clients. Health equity is concerned. There are a number of groups of people within Australia who are at particular risk of health inequity. These are people who identify themselves as Aboriginal or Torres Strait Islander, people who are from socio-economically disadvantaged backgrounds, people who live in rural or remote areas, people who live with mental illness, people who live with physical or intellectual disability, people who live with the effects of experiencing child abuse or neglect, people who are affected by discrimination and social exclusion, and people who are from culturally or linguistically diverse backgrounds. However, it is important to realise that equity issues in the population's health can affect any individual or group of people. The ones we just mentioned were some examples. In planning leisure and health programs for clients with complex needs, it's important that you understand the concept of empowerment. Client empowerment puts the client at the heart of the service. It's about designing and delivering health and social care services in a way that's inclusive to the client. An empowered client will understand and take responsibility of their health conditions. They'll feel they're able to participate in the decision making. They'll feel they're able to make informed choices about their treatment. They should understand the need to make changes to their lifestyle in order to manage their conditions. They should be able to challenge and ask questions to healthcare professionals, and they should be able to actively seek and evaluate more information. Clearly, considering empowerment is vitally important in designing leisure and health programs, it's important that you identify mechanisms to empower clients with complex needs. These may include involving the client in a genuine way to develop or select their leisure and health activities, providing the client with options and respecting their choices, supporting the client to promote their integration into a recreational activity, and simply telling the client that they can do it and believing in them that they can actually do this. Another important aspect when planning leisure and health programs for clients is to determine the recreational and leisure needs of our clients. This is often done using a leisure and health screening tool. You'll see an example of a leisure and health screening tool on the slide. This will give you an idea of the types of things that we'll look at when we're doing a recreational screen. For example, what are the most important factors that have allowed you to participate in physical activities for the last 12 months? The client will then circle which ones are appropriate. And another question includes, what are the main reasons you did not participate in the physical activities for recreation more frequently? It gives us an idea of any issues and also the needs of our clients. It's important that you're able to examine the range of issues facing people with complex needs. There are multiple complex and interrelated issues facing people with complex needs. In many ways, some of these issues are underpinned by education. Education is a key social health determinant, enabling people to be health literate and improve their capacity to access, interpret and utilise health information. However, for some people with disabilities, often education can be a disadvantage because their disability makes it difficult for them to learn and or because they have reduced lack of access to mainstream education. Education is directly linked to a person's employment prospects and level of economic participation. People with disabilities have significant lower rates of employment compared to the rest of Australians. Lower dispensable income can result due to poor access to education. This can result in poor access to equipment, transport, and fees required for a person to participate in leisure and health programs. Even when the government assistance for participation in leisure and health programs is available, it's not consistent or sometimes it can be insufficient. These are just some of the issues that people with complex needs may face. It is important that you demonstrate the use of appropriate language when working with clients with complex needs. Here are some examples. Speak to the client as you would speak to anybody else. Treat adults as adults. If the person with a disability is accompanied by a carer, address the client with the disability. Put the person first, not their disability. Try to avoid negative phrases such as suffers from or crippled. And use the phrase like a client who uses a wheelchair instead of saying wheelchair bound. Remember that a client's personal space can include their wheelchair and their crutches. Don't touch or push a person's wheelchair or move the crutch or walking stick without their permission. When speaking with a person who uses a wheelchair, try to sit down on something in order to talk to them at eye level. It's important that you design strategies that are relevant to culturally and socially different clients that you work with. People from culturally, linguistically, and socially diverse backgrounds may have additional needs. For example, clients may prefer to participate in same group activities. Clients may wear dress in a more modest way. Clients may require the use of a translator. Clients may require assistance in other areas to participate, for example, program costs or transport. Some activities may be targeted to participants from specific cultural backgrounds. With appropriate guidance from relevant community representatives and cultural experts, you should try to match these activities up with your clients. It's important that you show sensitivity to participants from cultural and socially different backgrounds. Ultimately, this means working with clients to ensure their cultural needs and social needs are met. Speak with clients, their families and carers and involve them in developing the leisure and health program. It's also important that you're able to adapt activities, programs and the environment, and in some cases the equipment, to optimise each client's involvement within the program. This may include modifying the program's technical requirements, changing needs due to fitness levels, changing goals, considering the client's needs, objectives, likes and dislikes, adjusting the technical difficulties of exercises, and incorporating feedback from medical or allied health professionals. I would like to thank you for your time today for participating in this webinar. Continue now by watching this brief video on your role and responsibilities when it comes to accreditation.